Hi, my name is Dr. Mitch Chasen. I'm the Medical Director of Reflections. I've been dedicated to the field of cosmetic medicine now for over 2 decades, and I've seen a lot of great new technologies and procedures hit the scene and revolutionize what we do and how we do it. Well, skin resurfacing is one of the cornerstones of a cosmetic practice. And today we're going to be talking about HA Rejuve and how that is revolutionizing what we do with the skin. So what is skin resurfacing? Well, essentially, skin resurfacing is improving the texture and color of the skin through a variety of mechanisms. But these mechanisms are essentially causing micro traumas, a little bit of trauma to the skin surface. And what that's doing is initiating a healing response, a controlled healing response. And that in turn delivers new collagen and elastin, which are the building blocks of our skin. And as a result, we see smoother, more youthful looking skin. If you get a cut, what happens? The body responds to that cut by delivering collagen and elastin and healing that wound. Well, how do we determine what we would like to use? Well, it depends on what we're looking to treat. Is it a fine line? Is it an acne score? Well, if it's an acne score, that's a deep problem in the skin, and we're going to need to use energy that can be delivered more deeply. That's why someone that goes into a spa for a microdermabrasion or a handheld microneedling treatment is likely not going to see very many results for acne scars. But if they just have some fine lines or just want to make the skin feel better, sure, those are wonderful treatments. Those treatments are aimed at something different than what we're looking to treat. So what's new in resurfacing? It's the injection of carefully chosen agents that during a process can improve the texture and tone of our skin. The result is caused by not only the agent we're injecting, but actually the microtraumas from injection. So we may inject a biostimulatory filler, a filler that's intended just to stimulate collagen and elastin. An example would be Sculptra, or what we call hyperdilute radius. We can do that alone, or we can do that in combination with a laser treatment or an ultrasound treatment to boost the results of each of those. Or we can inject Botox. Well, we're not injecting Botox in a large quantity in any one place on the face. We're injecting it in small quantities all over the face. It's what we call micro-Botox. And with this micro-Botox treatment, we're seeing improvement in the overall tone of the skin, improvement in the pore size, even improvement in the redness and flushing that people have. How about glutathione? Glutathione is a powerful antioxidant that can reverse what we call the free radical damage that's done to our skin. Free radical damage occurs from ultraviolet exposure recently and cumulatively through life. The other are dermal fillers. We can inject dermal fillers into the skin. People know those as fillers that we use to enhance the shape of the lips or the cheeks or the chin for facial contouring. But these fillers have been shown not only to improve contours, but to actually stimulate collagen and elastin. And in addition, they're replacing the natural hyaluronic acid that we lose during the aging process and from sun exposure. When you improve the natural collagen and elastin as well as hyaluronic acid, the end result of that is smoother, more youthful looking skin. And we combine that with glutathione, this powerful antioxidant which can brighten the skin and make it look more youthful. We have a treatment now that's called HA Rejuve. So HA Rejuve is combining injection of carefully chosen hyaluronic acid fillers with glutathione to create a 1-2 treatment and improvement in our skin. More youthful looking skin, more attractiveness. So what's the key with HA Rejuve? We've been doing this for a while, but we've been doing it with our hand. And unfortunately, our hand is just not capable of delivering the agents consistently to a given depth of the skin. These agents work best when they're at a certain level of the skin. With HA filler, we're looking for that depth to be about 1.5 millimeters, which is a very, very small depth and very hard to do with our hand consistently. In HA Rejuve, we're using a device called MediInject. That's a computerized system to deliver these agents exactly to a predefined depth that we determine. So with HA Rejuve, we're delivering a consistent result now, a safe result, and a result that has huge levels of satisfaction. So who's a great candidate for HA Rejuve treatment? Well, maybe a younger patient, maybe middle-aged, or even an older patient. And a younger patient, very often they're looking to be proactive. They're looking to prevent the signs of aging and sun damage that inevitably awaits them. In someone that has more obvious signs of aging in the skin and sun damage, they're looking to slow down these effects or even reverse them. So they're looking to improve fine lines and wrinkles and texture changes on the skin, and even brown spots and color changes that they see as well. So HA Rejuve is a wonderful treatment. And why has it become so popular? Well, in turn, because it's still an injectable, and people have become used to injectables in cosmetic medicine, whether they've had Botox injections or whether they've had dermal filler injections for contouring. They're used to this process. They're non-surgical in nature, the downtime is minimal to none, and the effectiveness is fairly quick. Some lasers take much longer to see the end result. So lasers and radiofrequency and ultrasound and radiofrequency and microneedling, these are all wonderful treatments, and they all have their place in a cosmetic practice. HA Rejuve is just the newest kid on the block, and sometimes that's just the treatment that is indicated to achieve a person's specific outcome. And that outcome is not just a physical outcome of what we want to see in the skin. That outcome is determined by approach. Some patients want to be very gentle. They want to do treatments that don't require much downtime. They want to do treatments that don't take much time in the office. They want to do treatments where people won't be able to tell what's happened, but that they just look better. And that's our philosophy as well. Improvement in the quality of the skin, in the youthfulness of a person, and the attractiveness of a person, but done in a subtle way where people just look better, but you really can't tell what's been done. The ultimate compliment is when someone is seen by a friend or a family member and they start complimenting them about their hair or their makeup and ask them, have you gotten a great night's sleep? Have you been away? You just look wonderful. You look so good. But they're not asking about a specific part of their face. That's success, and that's what we're after. And that's about making people happy. We look forward to patients coming in and articulating what their concerns are and what their goals are. And we can work together during this cosmetic journey and help determine what the best treatment options are. Because we do so many different things, from non-invasive things to the more surgical in origin, we're always able to find a treatment that meets a patient's needs. But we want people to be upfront. What are you worried about? What are your goals? What have you seen that you were worried happened to you? What have you seen in other friends or co-workers that look great, that what you think can make you happy? So with the different devices that we utilize, lasers, radiofrequency, injectable, surgery, so many different procedures and techniques, we're able to find a treatment that meets your specific needs. And when we meet your needs and we perform a treatment in which you just look more youthful, more rested, more engaged, it's an outcome that you'll be proud of, that you'll be happy with, and we will as well.